Hi, I'm Dr. Liz Swenson. I'm an OBGYN and the medical director here at Teal Health. Today, I wanted to go over a little information about HPV and cervical cancer screening guidelines. Cervical cancer is caused by persistent HPV infection. Screening for high-risk HPV allows us to detect these changes early and intervene before cancer occurs. In December of 2025, the American Cancer Society updated its cervical cancer screening guidelines to include again that primary HPV screening is the preferred way to screen for cervical cancer. It also now includes self-collect as an option for this screening. Primary HPV screening is the preferred method because it is just as sensitive as the co-test, which is a PAP and HPV together, and is more efficient. So HPV is the most common sexually transmitted infection. It will infect almost 80% of us by the age of 50. So right now, almost 1 in 3 women are behind on their cervical cancer screening. And this is really a challenge because cervical cancer is almost 100% preventable if we are screening regularly and get the follow-up care that is recommended. So when you get a diagnosis of HPV, it can be pretty frustrating and we don't always know when that exposure occurred. What we do know is that sometimes the virus can live in our system for a long time. So when we're first exposed, our immune systems are still mounting a response, and so the virus is detectable. Over time, as our immune systems start to function and we develop antibodies to the virus, that will reduce the number of viral particles in our system and hopefully become undetectable by testing. At this point, we're not sure if the virus is completely gone from our system or it is just at very low levels, like in a dormant state. But over time, our immune system function can change, say with pregnancy, with certain medical conditions, or even with menopause, so that the viral load might come back up into detectable levels later in our life. So if you've been exposed at any point in your life, you may again see a positive result later on, depending on your immune system function. This is why it's really important to keep screening at regular intervals over your lifetime. So our mission is to get everyone screened for cervical cancer. We just want you to choose the method that feels right to you. This could be in clinic with your provider, in a clinic setting with self-collect, and now you have the choice for at home with the Teal Wand.